If the woman has not been pregnant recently, it can take some effort to begin lactation. For some people this may take weeks or even months. Without adequate stimulation, milk production will slow and eventually stop. I can maintain a tiny supply for weeks without stimulus, but it takes effort to increase it, and once your milk has dried up you have a long way to go. To have a very strong supply of breast milk, the woman must have her breasts emptied several times a day. More is better, and at least 3 sessions minimum should be expected. Some women may not enjoy the feeling of breasts engorged with milk. The sensitivity and feeling of internal pressure can be uncomfortable for some, although it is something I do not mind and enjoy a bit. Occasionally a milk duct may get blocked, resulting in swelling and discomfort. If this happens, then light massage should be applied to the area and a warm rag placed over it to help the blockage be released. In extremely rare instances there may be an infection called mastitis, in which case there will be the same swelling and discomfort noted, with the addition of the area feeling hot to the touch, and a fever developing. If this should happen, then she will need to go to the doctor for antibiotics. Breast milk is technically safer than having unprotected sex because not all viruses can be passed through this method. However, some can, so you would not want to have an adult nursing relationship with someone who you do not know well, and trust strongly. The disadvantages, summed up, are that it will take time and effort to have this type of relationship. You should only do it if there is a commitment between you and your partner. If the woman enjoys the sensation and her partner enjoys suckling, then they probably will not mind spending time on their hobby together. In which case the only drawbacks are rare instances of blockage or very rare instances of infection.